And let's see. Oh, sorry about that. I had to figure out how to do the slides here through GoToMeeting. So this presentation is going to examine what consumer engagement is. The term refers to a diverse set of activities that include interacting with healthcare providers, seeking health information as a consumer, and maintaining a personal health record, and also playing an active role in making decisions regarding one's personal health care. So the strategic objective of consumer engagement is connecting consumers to their health information, partnering with others to directly reach consumers, like our webinar here today, and educating others to ensure that they understand their rights relative to accessing their health information, and also becoming recognized as the trusted voice across the health information environment. So FHIMA's consumer engagement model is about informing, engaging, and partnering. So we inform on consumer engagement through our contact with the public, and as far as in our professions, and as well as even our family members and such. And then we engage and interact with patients and their families in our roles as HIM professionals. We also partner with healthcare facilities and healthcare providers to help educate, empower, and engage patients and their families. We do this by, we engage directly with patients and their families with the goal to connect them with their health information and ultimately empower them to engage in their care and improve health outcomes, and also to identify or create opportunities to engage patients and their families. We communicate and demonstrate to patients and their families how to access and amend their health record, participate in community events, such as health fairs, charity walks, senior centers, and such. And then we partner by collaborating with healthcare facilities and providers to educate, empower, and engage patients and their families. So the consumer engagement topics for today are going to be the personal health record, patient portals, accessing and amending medical records, privacy and security concerns, as well as mHealth applications, and the patient-generated health data. So what is a personal health record? It's a collection of information about your health. It can be in a paper format or it can be in an electric format. And it's not the same as the electronic health record or the electronic medical record, which is owned and operated by a doctor's office and hospitals or health insurance plans. The benefits of having your own personal health record are tracking and accessing your health record. You can track your progress toward health goals, such as lowering your cholesterol level. You can make the most out of your doctor's visits by being ready with questions for your doctor and information you want to share with your doctor, such as blood pressure readings since your last visit. You can also manage your health between visits by uploading and analyzing data from home health monitoring devices such as blood pressure cuffs, and remind yourself of your doctor's instructions from your last appointment. You can also be organized, so you can track appointments, vaccinations, and preventative or screening services such as mammograms. In fact, in a recent study, found that when parents use personal health records for their children, the children were more likely to get their preventative well child checkups on time. The information that you collect and store on a personal health record is personal, but it is important to be able to share this information with your healthcare provider. So one of the ways that we do that is through, there's so many ways now. Mobile health apps are one, and they're good for notifying you of important reminders such as your healthcare visits, medication refills, and more. And there's also all sorts of other things too that just day by day things are getting more advanced with all the different like wearable technology and such. And so healthcare consumers become engaged by maintaining a list of their active problems. So knowing like a list of your chronic diagnoses or ailments in between visits. Also, it helps to keep a track of your medical history as far as surgeries and such. And also too, like your personal history and your family medical history. So you can have that down if anyone ever asks you that at a visit about different family members and their health, so that they can see trends perhaps in genealogy. And then also too, it helps keep track of, you can also have your list of medications too for physicians as well. And then also in some apps, you can actually even keep track of your different laboratory tests. Like I know on my personal portal with my physician, I can look up my lab results. And so if I were, I'm actually considering switching physicians, and then this way I have a record of that. I can go ahead and print that stuff out and then have it for my next physician. And some of them too, you can actually keep copies of radiological exams and pathology reports. And so there's some of the information that goes into a personal health record can be your primary care doctor's name and phone number, as well as other physicians that you may see, allergies, including drug allergies, medications, as well as dosages, and then your chronic health problems such as high blood pressure or hyperlipidemia, major surgeries with the dates. You can also keep your living will or advanced directives in your personal health record, the results of the screening test like we were just talking about, cholesterol levels and blood pressure readings. You can also keep track of, especially too with like the wearable apps or products such as Fitbit, you can keep track of your exercise and dietary habits. So you can also track health goals, such as stopping smoking or losing weight. And again, you can keep track of your family history, and also your immunization history is another important thing to keep track of in a personal health record. Okay, so I was just talking about my patient portal with my physician's office. It's a secure online tool. I actually can access it from a website or from a mobile app I have on my phone, and it gives me 24 access anywhere I have an internet connection to my health record. And again, it includes my medications, immunizations, allergies, labs. However, it is not the entire medical record. And another feature that some patient portals have, and that actually that's one of the features of mine is that that's how my physician contacts me about reminders for my visits, as well as you know, a lot of times before a visit you'll have to do lab work and such, so they can actually email you through the secure connection orders and such. So that's another good feature of a patient portal. And it definitely improves the organization and helps foster a stronger patient-provider relationship and communication, and it empowers patients. The more data and information you have, the more involved you're going to be in your own health, and it promotes improving patient engagement and ultimately achieving successful health outcomes. So again, a patient portal benefits. It improves their organization, fosters the strong provider communication, it empowers patients, and it supports patient-provider care between office visits, and again, promotes the goal of improving patient engagement to, again, ultimately achieve successful health outcomes. So some of the trends in patient portals are personalization, delivering patient-specific information. It's fundamental to increase patient engagement. So the more personal information and that they can, provider can incorporate in a patient portal, the more engagement they're going to get from patients. And then also too, mobile device access. Patients and providers are able to access, transfer, and communicate 24/7. Doesn't mean that the provider is actually going to reach back out to you if you're emailing at 2 o'clock in the morning, but through the portal, they're able to get back to you first thing in the morning. And then again, we have the wearable technology. Fitbits and smartphones are getting smarter every day, and they provide a single view of health data such as blood pressure, heart rates, and are beneficial to both the patient and the entire healthcare support staff. So, you know, if you're constantly wearing your Fitbit, you notice that you know, it tells you things like that you're constantly waking up in the middle of the night, or your heart rate is elevated when you're not exercising. These are things that you're able to communicate to your physician. So in this case, the portal becomes a channel for the patient to set up appointments, request prescription refills, ask questions. It also gives you reminders for visits and reminders for immunizations and follow-up visits as well. And also it's a way for a provider to provide you with educational resources as well regarding different chronic diseases or wellness and prevention. So some of the things to consider with a patient portal implementation. One of the biggest things is the portal on a secure network. And then also to how are invitations to join the portal sent? Are they done in person or through email? And if it is through email, is it a secure email? I know from my physician's office, in order to get onto the portal the first time, you actually have to get, I get a slip of paper from my physician's office with all of the information. They don't send out the information over the internet because they want your first connection to be a secure connection. It's definitely password protected. And on mine, I haven't actually, this is one thing I should actually ask my my physician, is that a lot of times you want to have passwords where they expire so that you reset a password so that it's not always the same in case something were to happen where someone were to get your password. I don't think mine is easily reset. I have to actually go in and request from my physician. So the next question is who owns the patient portal? In the past, it's always been generally accepted that healthcare records were the property of the healthcare facility, and the information contained in the healthcare record was the property of the patient. With the implementation of EHRs, specifically patient portals, there has not been any concrete clarification. However, a general conclusion is similar to previously, that the medium, the portal, actually belongs to the physician, and then again, the information belongs to the patient. So regardless of the medium in which the protected health information is stored, the provider is responsible for the portal and all the information uploaded to it, and the maintenance and the day-to-day monitoring of incoming message. So therefore, the The provider owns the portal, and the patient owns the information. And that's another thing you want to find out too, if you're using a portal with your provider, is whether or not they're actually maintaining it. If you send a message through your portal, is someone monitoring that on a daily basis? Or, that would be a question to ask. Or, were you better off calling the physician if they're not monitoring it? That's another thing to consider too with small practices, is that they may not have the staff to man a portal on a daily basis. So you still may need to pick up the phone and call. So patients' rights, according to HIPAA, is that, again, patient is able to obtain a copy of their health information, and they also have the right to amend information that is incorrect in their health record. And they also have the right to know who accesses their information and what information is being accessed, as well as they have a right to file a complaint as well. As HIM professionals, we all know a little bit more about HIPAA than the average consumer. So part of our job is helping the consumer know their rights. So again, that's part of like when we go to the doctor's office, our NOPP, the Notice of Privacy Practices. So it informs the patient how their information is being used and shared, and it describes whether or not they are able to give permission for health information is being shared by the provider. For example, marketing purposes, that a patient would definitely have to sign off for such a use, and that's one of the things that is given to the patient, the information given to a patient in their Notice of Privacy Practices. And a patient also too needs to know that they're able to obtain a report stating when and why their health information was shared and for what purposes. So one of the big things for us as HIM professionals too is to help people understand that they can access and they can amend their medical record. So as HIM professionals, we should all know that a patient must be given access to their medical record within 30 days of a request. And there's only one extension available, so that means the maximum amount of time between the time that a patient requests their information to the time that you give it to them should be no more than 60 days. It should be within 30 days, and then for cause, like say, records are stored off-site. Like at the facility where I work, all of our records before we went to our EHR, which in skilled nursing, we didn't switch over as early as, say, inpatient facilities. And so we have Iron Mountain that stores old medical records for us. So in that case, I would have to call someone and then have it delivered, and it may be a situation where it would take longer than 30 days, and in that case, I would have to alert the person making the request that it's going to take a little bit longer than 30 days, but it should take no more than 60 days. And so a lot of this is part of the high-tech, or HIPAA and high-tech, which provides a right for patients to receive their health information. Oops, sorry, went forward. And then providers may deny patient access to medical records only in certain situations. And as we know, that as HIM providers, one of those situations is psychotherapy notes. And in those situations, you would have to check with the physician whether or not the patient is able to receive those notes. And then also to a special request as well, if a third party is requesting information from your facility, whether or not, if it doesn't specifically state psychotherapy notes in a release, the patient would have to specify whether or not same goes actually too with any type of HIV documentation as well. So amending medical records, the patient can request a change or an amendment to their health record, and they may be asked to write a letter or complete a form, and then they have to provide a reason to support a requested amendment, and the request for amendment form will be added to the permanent medical record, whether or not it is approved or denied. So say a patient notices that there's a mistake in their medical record, what they think is a mistake, they're able to petition the facility and where the mistake it has been made, and in some cases it may not be a mistake. The patient may just not like what's in the record, and so the physician wouldn't necessarily just take information out of the record because the patient wants them to. But they do have to include in the permanent medical record that the patient asked them to amend the record, so that stays with the record. And so the provider's responsibility for amending is that they must respond to a patient's request no later than 60 days after the request has been received. If the healthcare provider created the information, he or she must amend inaccurate or incomplete information. If the provider does not agree to the request, the patient has a right to submit a statement of disagreement, and the provider must add this to this statement to the medical record. And patients can request a change or amend their health record in the form of a letter. And if they do, some of the things that must be in a letter or a form, if your facility has such a form, is the patient's name, address, telephone number, dates related to the information requested, what's the patient's asking to be amended, and the treatment date, as well as the patient's date of birth, medical record, and a description of the information that the patient believes to be inaccurate or incomplete. This is basically what I was just stating here, the 60 days. Okay, so mobile health applications. That's the mHealth. And these are the use of devices and practice in the practice of medicine, such as tablets, smartphones, wearable devices such as Fitbit, now smartwatches, and the downloading of health-related apps. I know, like with my Fitbit, I can download all sorts of different apps, and helps with the flow of information over a mobile network. And it can improve communication between patients and providers. One of the things to remember, though, is there are thousands of healthcare-related mobile applications. Some are free, others can be purchased at varying costs, and they are not all created equally. There are many apps that provide valuable resources to benefit patients and healthcare providers, and there are just as many apps that offer quick fixes and may not follow guidelines. So don't assume that just because you're downloading an app that's a medical, sorry, I skipped forward there, my hand slipped. Don't assume that just because you're downloading an app and it's an mHealth app that app provider is actually following HIPAA guidelines and that your information is going to be secure. Because depending on the type of the type of business that it is, they may not have any type of business associate agreement with your provider, so they're not under the same rules as healthcare providers when they're just providing an app. So these are things to think about whenever downloading any type of app or putting or uploading any of your personal information to these apps is how secure they are. I would definitely do research into apps where I'm putting my personal health information online. So some of the different apps are like diagnostic. I know now I've seen you can do all sorts of things now with these mobile apps. Like definitely you can do your blood pressure now. I think you can even do. I've seen lately you can do an EKG. There's all sorts in the trend. You know, is that there's more and more apps every day. So when considering a mobile device or a mobile app, think about privacy, definitely. What you should know about the privacy and security of the mobile health app. Definitely do your research on the app. You want to know what kind of information is collected and how it's used. What data is collected automatically. Does the device collect precise real-time location data? Because I know a lot of these apps are now being used to track people so that they can target them for advertising. So you want to be careful when downloading apps and think about these things, such as like I said, geo-targeting, and then also whether or not third parties have access to the information that is collected through the app. And if so, if third parties do have access, are you able to opt out of that? And also, what other tracking technologies are used, if any? And who is the contact for questions or issues if you're having a problem with the app? Or and you also want to know too that if there is any type of privacy policy and who the developer of the app is. Are they in partnership with someone who may be selling your information? So when looking for the right app, you need to consider why. Why are you considering the app? Did your doctor recommend the app? And if it is recommended by your doctor, you want to know whether the app follows HIPAA guidelines. And is the app going to help you reach your health goal? Or help you learn more about your personal health? And another thing I always do when I download any app, whether it be a health app or even just a game, is check out the reviews. What are other people's experiences with a particular app? And also too, the ease of use. I mean, if there's different options for the same app, you definitely want to look at the reviews and see what other people are saying about it. And then maybe also too, check a consumer website to see the practices of the company that makes the app. So again, you want to know about privacy and the policies and settings for apps. You want to look for the trusted symbol. I definitely look for that too. Like whenever I'm on a website as well, whether or not I have that little padlock up in the corner. And this is one of the symbols that's used for apps as far as whether or not they're privacy certified. So you want to look for that symbol. You also want to be smart whenever you're doing using apps. You want to use password protection and encryption when it's available. You also want to record your phone's identifiers and keep them somewhere safe. Also, if you're going to have all this information on your phone, or you want to, possibly think about using a locator service for your smartphone and keep that information, you know, with your computer. And then that way, if your phone does go missing and it has all this information on it, you can then wipe your phone remotely, as well as any other handheld devices, just in case it's lost or stolen. And then that way someone doesn't have all of your personal health information. One of the things to think about too is that, I don't know if you all know this, but a personal health record is actually far more valuable than a credit card. So if someone steals your credit card, chances are you're gonna cancel that credit card right away, and you're not going to be using it. You know, so the window of opportunity for for a thief is maybe one or two transactions on a stolen credit card, whereas when it's your health record that's stolen, people can actually, if there's enough information in there, they can actually create a whole new identity using your information, and then do things like, not just use a credit card, but like, sign up for their own credit card that goes to a different address, but it's using your information, your social security number, your date of birth, and especially too, if you have like your family medical history on there, often you'll have like your parents' names and things like that, which are all the questions that a lot of times that are used to verify that you are who you say you are. So whereas credit cards go for pennies on the dark web, health records are actually quite marketable. So, and that's because there's so much information included in a health record, and it's far more valuable to people that have, that are criminally minded. So the next subject here is the patient-generated health data resources. So it's data that's created, recorded, gathered, or inferred by or from patients or their designees, and it includes health questionnaires, data points such as blood pressure, glucose levels that are taken by the patient, self-management diaries, patient and family health histories, and healthcare directives. And the areas that are likely to play a significant role when it comes to patient-generated health data are is one of the things to really be mindful of is what as providers or as HIM professionals, and we're receiving this data, is what is going to be integrated into the record, and the role that we play as significant stakeholders in the engagement process, and the role as employers as drivers for creating a culture of health. Other things to consider are emergence of new technologies that facilitate patient, family, and provider interactions. So a lot of the stuff when we're talking about personal health records are things that the patient is collecting. So one of the things we need to watch out for is making sure that what we are including in our health record is actual health data that we know is accurate. So as health information professionals, we provide resources and information to consumers on how to access their record and how to request amendments when appropriate. We communicate with patients about how their information is exchanged and identified. We assist patients in understanding how they can contribute data to their health record, and we explain how the EHR enables patients to, not the EHR, that's a typo, how the personal health record enables patients to take charge of their own health care. So AHIMA's recommendation for management of patient-generated health data that's generated by mobile health technology is to create a strategic information governance framework that best meets clinician and patient needs for reliable collection and dissemination and use of patient-generated health data. It includes patient-generated health data as part of an overall organizational information governance initiative. We need to develop, sorry about that, I went forward. Include policies and procedures that assist with the determination of when patient-generated health data should be incorporated in the health record when transmitted from an unverified source. We need to identify and define the intended use and reliability of the technology that is used to collect patient-generated health data and incorporate it into the existing EHR system. We need to work with information technology leadership and EHR vendors to design a system that meets consumer and clinician needs. And then we need to identify and evaluate technology solutions that allow for segregating the patient-generated health data in the EHR that is clearly designated as having been patient-generated. For example, creating a special patient-generated health data section of the health record so that it's clearly known that that information was collected from the patient and not the provider. So AHIMA recommends specific things for the management of patient-generated health data, and that's establishing an inventory of the various types of the most frequently used mobile health devices to ensure the EHR can accept and process the uploaded data, define policies for clinical documentation requirements when patient-generated health data is used for decision-making or for patient care, and to update the legal health record definition to include patient-generated health data when it's used for clinical decision-making. So, and then also establishing workflows to ensure the review of patient-generated health data by clinicians. We also want to review and update existing coding workflows related to when patient-generated health data is identified in documentation to support accurate coding. Okay, so AHIMA recommends for management of patient-generated health data that require HIM involvement when planning for the design, usability, pre and post implementation of the EHR functionality that will allow patient-generated health data to be uploaded by the patient. Review capabilities with the EHR vendor for appropriate processing of data uploaded from a mobile device versus data gathered from another source, such as PHR or other PHR health records and social media applications. This is referring to some of the things that are created by, say, wearable devices. And then also to determine the need for data tags or notations within the EHR to indicate if the device and or app is regulated or otherwise prescribed by the care provider. So this is, again, referring to devices and apps that are prescribed by a provider, whereas the information that is generated by the patient and not collected in the office. So there needs to be some sort of dissemination of which information comes from the firsthand and which comes from the patient. So we need to work closely with compliance and risk management for the evaluation and identification of factors for the assessment of the validity of patient-generated data derived through technology with regard to the intended use and the reliability of the technology. Okay, so AHIMA recommends that there be standards. So there's the development of regulations and standards for mobile health devices under the direction of the Food and Drug Administration. I'm sorry, there are standards that are in the works that are under the direction of the Food and Drug Administration, such as a routine review of the FDA guidelines and data on the FDA approved and regulated mobile health apps. So that's one of the things you want to look at when you're considering a mobile health app, is whether or not it is regulated. And so some of the current engagement challenges for consumers and patients is there is a lack of patient and consumer involvement. And then also too, there's cost to consider. One of the things too with the lack of patient involvement in the healthcare process is that patients sometimes are not interested in becoming involved in the healthcare delivery process. They, you know, in the past, patients have taken a more passive role. However, that is changing now. One of the things to consider too is the diversity level and education and understanding of healthcare terminology. I believe now, as we're going forward with the technology-driven society that we live in, that people are becoming more informed and they are becoming less passive and taking a role in their health and wellness. So, and then as far as cost considerations, the most affordable treatment option may not always be the best care path for an individual. And the new ways to interact with the healthcare team, the power balance between physicians and patients is shifting from more deferential, doctor knows best, to the patient knowing and understanding the content of their medical record and wanting to receive health-related data in real time. So for change management, we need to communicate at all levels. And it's difficult to accomplish this in the short face-to-face interactions between patients and providers. So again, the concerns with the new interactions are security of personal information, and they include hacking and identity theft, and then also concerns with personal information getting out there. Again, we want to consider whether, you know, HIPAA regulations, when we're suggesting when a provider is suggesting different apps or devices to their patients. You know, it may be great, you know, to have the patient wear the Fitbit and use the information, but one of the considerations is definitely the privacy and security, and then the responsibility of the provider. So, emerging technology and technological advances is a continual innovation and technology for healthcare, such as smartphone apps, and the comfortableness of the people using them is growing greater every day. So there's a lot more things to consider. So this is from the AHIMA CEO, Lynn Thomas Gordon, and this is her take on our role and the consumer engagement. And traditionally, the clinical care team played a major role in the patient experience, but the change in the way patients consume their health information means today's HIM professional in giving healthcare consumers the tools they need to make all interactions and communications with their providers meaningful and efficient. So our role as HIM professionals is helping individuals manage their health information in a private and secure environment. So we should provide resources and information to consumers on how to access their health record and request amendments when appropriate, and communicate with patients on how their information is exchanged and identified, and assist patients in understanding how they can contribute data to their health record and become part of their wellness experience, and explain how the, again, that should be PHR, enables patients. How can HIM professionals continue the trend of increased confidence among patients? We can stay abreast of current patient perspectives. We can also be knowledgeable on patients' rights and how they're used. We can facilitate ongoing training on privacy, security, and confidentiality within our workforce, so with our coworkers. We can utilize the various toolkits and resources on privacy and security that are provided by AHIMA. So you can go to the AHIMA website and look at the different toolkits that are available. AHIMA does have a consumer engagement toolkit as well. If anyone's interested in seeing that, I do believe I have a copy of it, so you can just shoot me an email afterwards and I'll provide that to you. And then we definitely stay up on HIPAA standards, identify policies and procedures and processes that must be developed or revised to comply with standards. We need to become knowledgeable about other applicable federal laws and regulations relative to privacy, confidentiality, and disclosure of patient health information. And we also need to to keep checking, like the websites, like I was just mentioning, the FDA getting involved in mobile health. That's one of the things that we should continue to look for and be knowledgeable about, so that when we're suggesting things to our patients, that we're suggesting the best resources available. So some of the places where we can look are component state health information management associations, such as your organization or mine, which is Southwest FHIMA. Other places to look to, or if you have any questions, maybe talking to your legal counsel on it. And that way we can ensure that the federal and state regulations, though, when I say legal counsel, that would be legal counsel at your facility. We also want to train members of our workforce on the policies and procedures as they're related to personal health information. We just want to maintain appropriate documentation. So that is when we're talking about that too, about what is patient-generated health data, and then what's the empirical data from the physician. So we want to make sure that we disseminate between those two, or differentiate rather. And then we want to monitor compliance and implement corrective action when it's needed. So what we want to do with that is review contacts with any contracts with any business associates who our information is disclosed to, and ensure that the language contained in those contracts complies with the state and federal laws. We also want to monitor compliance and implement corrective actions, as I just mentioned, in regards to business associates. We also want to encourage non-covered entities that maintain individually identifiable health information to construct policies and procedures So that's one of the things we want to know when we're suggesting different mobile health applications or personal health records, is to make sure that there's policies and procedures, and that the information obtained and disclosed is the minimum necessary. And then again, you know, that the workforce is trained about the importance of privacy and confidentiality. Is to let patients know that they're able to ask for a disclosure log. So you could go into your physician's office and ask for the disclosure log of every person that's been given access to your health record. So some of the resources I was talking about were the AHIMA toolkits. So you can go on the AHIMA website and Google, and type in toolkits, and you'll find some of the different resources. And then also, too, you might want to look up the AHIMA Bill of Rights and some of the frequently asked question videos and web links. And here's the references. I believe everyone was given a copy of this, PDF of this PowerPoint, so that you can go ahead and look at it and check out the references on your own if you'd like. And I can take questions now if anyone has any questions.
Yeah, I'm going to go ahead and unmute everybody on this side. So if you have muted yourself individually and you have any questions, you can step up one at a time and ask questions, or you're welcome to ask them in the chat, and I'll read them from there. Any questions? You know, and I have one. I was thinking back to, you were talking about the smartphones and protecting them. We're keeping our PHRs, we're running our patient portals on there. Is there anything that talks about how well in securing your phones that the combination of your pins as well as like the fingerprints, is that a recommended course of action as well, using the biometrics on your phones to protect the data, to protect the logins?
I would think that that's definitely a good way to go if you're going to keep that stuff on your phone, is to definitely have, minimum password protection. But now with the new phones with the biometric protections, it's a lot more difficult for someone to be able to, if they find your phone, to be able to access your information. So I would definitely, if you have biometrics on your phone, to utilize that feature, definitely.
Okay, thank you. Any other questions?
And again, if anyone wants any of this information and you want me to send you any of this information, you can go on to, I'm the president of Southwest FHIMA. So you can just go Google that, and my contact information is on there. So if anyone wants a copy of the AHIMA's toolkit for consumer engagement, I have that. If you're interested in that, I know HIM week is coming up. And so this might be a good presentation if you want to maybe speak with your bosses about maybe presenting this to your team. It would be a great idea for HIM week.
All right, well, it doesn't look like we have any more questions. I would like to thank everybody for joining today. Again, please, if you did log in through the phone, and not through the desktop or web application, please email me and let me know that you were here so I can get you your CEU in links. And if you do have any questions, you can get a hold of Lydia directly, or you're welcome to email them to me, and I will get them to her. And Lydia, thank you very much for your time today. I really appreciate it. There was a lot of information, so thank you very much for presenting that to us. And everybody have a great day.
All right, you too. Thank you very much. Bye-bye.
Bye-bye.